Hi everyone, it's Dimitri again. Today I'm going to be making a video about a lot of the side effects that come with taking testosterone when you're undergoing hormone replacement therapy. I actually have the paper from the clinic I did it at, so I'm going to be reading off that. Some of these you've probably heard, maybe some of you haven't. I'm not sure. Some of these side effects were actually surprising to me. So, I mean, if it can help someone else out there the way it helped me, I'm going to put it in. Okay. So, the first thing it says is, what is masculinizing hormone therapy? Sorry. That is a medicine that can be used as part of your gender transition process. This medicine is called testosterone, which is T, It can be given as a gel, a cream, or a patch, and as a shot as well. I'm taking the injections. It's once a week. I'm taking 100 milligrams a week. My doctor wanted to get me started slow. I think that's usually how most doctors are going to start you off. I believe she said on my next visit, which would be in 52 days, I'm gonna go in, see how it's going, and she might up my milligrams to 200, which is cool for me because she said it doesn't really matter how many milligrams. It's not gonna speed up. It just depends on you and how you adjust and take to the testosterone. So for me, I'm still only on my first injection. My next injection is coming up in a couple days. I honestly don't feel any different. Still just excited. Anyway, the changes to your body, which here are called the benefits, which are, obviously, your voice will become deeper. You may grow a mustache and beard. The hair on your body will be thicker and will grow faster. Your clitoris will get bigger. Your muscles may get bigger and get stronger. You'll probably stop having a period. That's awesome for me. For me, when I heard that the period was going to stop, I was like, yes. Hate periods. You will notice less fat on your buttocks, hips, and thighs, and more on your belly. I heard that the fat moves on your body, but I wasn't quite sure what it meant or where, so now knowing that it's kind of going to all move to my belly, I am going to try to start losing weight, and that also comes into play with the testosterone too. I'll read that to you right now, which is the risks. Testosterone can increase your red blood cell count. I can't talk today. It can increase the amount of fat and or cholesterol in your blood. We're going to be more prone to heart disease, but I think that's usually just guys in general. So that is something to watch for. And also having to do with weight and how much you're eating, it will increase the chance of getting diabetes. So you will have to be watching your blood sugar. And for me, I know that diabetes actually does run in my family. They will ask you at your appointment what diseases and what things run in your family, probably so that they can help you prepare for what may come with the testosterone. And I know diabetes does run in my family, so I will be losing some weight while undergoing this transition. And testosterone can harm the liver, but that here is considered rare. If you think I am making this stuff up, I'm not. I swear, it's on the papers. You can ask your doctor about it. There's some things that I still have a question about. I wanted to ask my doctor if I can be taking men's vitamins yet, now that I've started the testosterone, if I need to wait. When I do find out that answer, I'll let you guys know. It says the risks of testosterone may be higher for people who smoke, are overweight, and have a family history of heart disease. So there's that to know. What are some of the side effects of testosterone? Acne, thicker and more oily skin. The hair on your head may get thinner or fall out, which is accumulated to male pattern baldness. Most guys, I have pretty thick hair, so maybe it'll help me. Mood changes. increased sex drive, vaginal dryness. I have met a FTM, transgender guy already, and he did say he is like attacking his girlfriend a lot more. The sex drive is real. He also said he's already been undergoing the growth from his clitoris, and he said that when he gets like in the mood, it is really uncomfortable, that sensitive part rubbing on your pants. So he was like, maybe you might want to not wear some tight pants, shorts, loose pants, loose jeans. He said that helps. I don't know if that helps anybody. Okay. Besides testosterone therapy, what are my other choices? I'd never heard about this before. It says, you could do nothing. Another way to masculinize is to have surgery. If you are interested in other options, talk to your doctor or nurse. I have no idea what other ways you can transition without testosterone, so that is interesting. For me, personally, I'm going to stay on testosterone. If anyone else wants to find out about that, I mean, it's on the paper. I have no idea. You can choose to stop taking testosterone at any time. If you decide to do that, talk to your doctor or nurse. Not all the side effects of testosterone are going to be permanent, so you may find that when the estrogen starts building up, when you stop taking testosterone, a lot of things that changed are going to go back to the way it was, and not a lot of people know that, and they get very unhappy with that, or they don't expect it. So, let's see. These are the changes that are usually not permanent and will go away if you stop taking the medicine. Your increased sex drive. So if you stop taking testosterone, your sex drive is not going to be so high. Changes to your body fat. Your fat will go back to where it was. Changes to your strength. I think that depends on how much you really exercise, to be honest. I'm not sure. But I don't know. Faster hair growth. I guess it means you're not going to go bald anymore. It says some of these changes can take 2 to 5 years, or it can take a month or longer. No one can tell how fast or how much change will happen. It literally depends from person to person. Some of the changes that will probably not go away even if you stop taking testosterone include the growth of your clitoris. Once it's grown, it's grown. Your lower voice. So once your voice drops, it's dropped for the rest of your life. Mustache and beard. Sounds cool to me. Male pattern baldness. Okay. That kind of... I don't know. Thicker body hair. Okay, so obviously you're probably going to stay a hairy beast, but I'm curious about the baldness, because on the one that says it's not permanent, it's faster hair growth, I'm wondering, like, does that mean when I get a haircut, my hair's not going to grow that fast anymore? And then once I stop testosterone, if I ever do, it will? I don't know. Some of these things are not very clear. Maybe other people understand it better than I can. And the last thing it says here is, can I get pregnant? There are still some transgender guys out there who don't ever go through bottom surgery and do want to get pregnant. So the answer to that is, no one can tell you for sure if taking testosterone will affect your ability to get pregnant. You could get pregnant, or you may never be able to get pregnant in the future, even if you stop the testosterone. If you have sex with a person who makes sperm, you need to use birth control to prevent pregnancy just in case. If you do get pregnant, you must stop the testosterone. So if you think you may want to be pregnant in the future, you should probably talk to your doctor or your nurse about the options before you start T. So that is pretty much all I have for the paperwork having to do with FTM therapy and the side effects and stuff. Hopefully someone or some people got to learn something or knew about it, or if you're hearing it again and it sounds like a broken record, I'm sorry. Just trying to put it out there just in case. Alright, I'll leave it at that. Thank you for watching.